Hello, my name is Lumey, and today we presented about orthopedics condition like fracture, arthritis, and bone disorders. What we cover? The first is condition overview about the diagnosis covered in this chapter. The second is the occupational impact and how this condition affect daily life across domains. The third is the occupational therapy services that we're gonna see the skill intervention of occupational therapy provide. And the last one is the assistive support like orthosis, equipment, and precaution using during recovery. So the condition overview, the first that we have here is fractures. That is a break in a bone continuity from trauma or disease, including hip, distal radial, humeral, and scaphoid fractures managed by closed reduction or reef. The second one is osteoarthritis, the most common joint disease involving destruction of articular cartilage, most disabling in the hip, knee, and hand, and often treated with arthroplasty. The third, we have osteoporosis and osteopenia. That is the low bone density that increase fracture risk. Osteopenia is a reversible precursor, while osteoporosis is an irreversible, often silent disease. The last one is heterotopic ossification. That is a normal bone formation in soft tissue following trauma, fractures, or arthroplasty, leading to joint stiffening and restrictive motion. How occupational impact? So for self-care and ADL, immobilization, pain, and weight-bearing precaution, limit dressing, bathing, and hygiene, and reduce pinch strength from hand osteoarthritis, affect grooming tasks. For IADLs and home management, hip and knee condition limit driving, cooking, and community mobility. About half of hip fracture survivors report long-term difficulty getting to places out of walking distance. For health management and rest, reduced pinch strength can impair opening medication bottles and pain from fractures or arthritis commonly disrupt rest and sleep. And the last one is workplace and social participation, that the pain and motion loss limit return to work, hobbies such as gardening or knitting, and social participation, which can affect concept and motivation. Okay, to better understand, I have here a case sample. That is Diana of the age of 74, first reaching for a mug and sustaining a distal radial fracture treated with reef, referred to occupational therapy reporting difficulty with grip, wrist motion, and daily tasks like opening jars and dressing. For the evaluation, identify limit wrist range of motion, reduce grip strength, and difficulty with two-handed tasks such as a jar opening and clothing fasteners. For intervention, custom wrist orthosis, edema and pain management, and early initiation of occupational focus therapy. For clinical reasoning, early initiation and higher number of occupational therapy sessions are linked to a better functional recovery after distal radius fracture. And the Diana regained enough grip strength and wrist motion to resume cooking and knitting independently, with the orthodoxy winning as a healing progressive. For occupational therapy services, the first that I have is the holistic evaluation. That is the assessment of client factors, injury circumstances, and premor, premor, premorbid function to guide occupational focus goal setting. The preoperative education is the pre-assessment training on postoperative precautions, home environment, and support system before hip or knee arthroplasty. So the ADL and IADL retraining, training in dressing, bathing, and driving that respect hip weight bearing precautions, since return to daily tasks improve steadily with therapy. And the multidisciplinary rehabilitation is to coordinate occupational therapy and physical therapy after hip fracture, is linked to a better emotional distress, fatigue, and daily function outcomes than physical therapy alone. The assisted support, the orthosis and spleen, we can use tongue speaker orthosis reduce pain from carpometacarpal, osteoarthritis, and custom wrist orthosis support healing after a distal radius fracture. For ADL adaptive equipment, we can use is to help to compensate from pain, weakness, or limited motion during tasks such as dressing and grooming, particularly while following hip precaution. For post-surgical medical equipment, we have to continue the passive motion machines and knee immobilizers support recovery after total knee replacement. And for home safety and fall prevention, so home hazard modification and community-based fall prevention program help to reduce the risk of a subsequent fracture and support for efficacy after hip fracture. And this is my reference.